this is the title of my poster and my presentation. And here's a bit of background. So, as Penny said, I'm a highly specialist SLT, and I've been working in specialist learning disability services since I qualified in about 2011. At the start, I was employed by MFT, and now I work for Merseycare. I still work with adults with learning disabilities, but a lot of different people. So I work in prisons in Liverpool now, so a bit of a different job. So a bit of background to my kind of original question and why I embarked on the internship. So learning disabled adults have historically been excluded from society and from being involved in decisions which affect their lives. I really don't have time in this 5 minutes to sort of go into that any further, but there's a long history there. Learning disabled adults on average die 15 to 20 years younger than the general population. This can be attributed to many associative factors, including access to timely and effective healthcare, which brings me to talking about specialist community learning disability teams, which it's generally assumed that the primary focus of those teams nationally is to kind of change that figure, but also ensure that people can access healthcare services on the same level as everyone else and reduce those health inequalities. However, there's actually no statutory framework for how those services should look, how they should be delivered, what kind of level of resourcing there should be. It's an absolute lottery depending on where you live in the country. And as you can see on the slide there, we as teams emerged in the kind of 1980s and 90s as part of the so-called care in the community government policy at that time. So there has been some guidance published, but this is by the National LD Professional Senate, which is not a statutory body. And that's just a citation for where you can go and look at what that evidence says, and they kind of draw on these national policies and drivers in what they do. So prior to working in statutory, kind of not statutory, specialist learning disability services, I'd actually worked for MENCAP, and I worked with the local MENCAP branch, doing kind of a lot of advocacy work and helping to kind of facilitate ways to help the members of the organisation design what that organisation was going to provide the next year. And then I stepped into the NHS and I was like, oh, this is different. We don't really do that here. We had things called partnership boards when I first, specialist learning disability partnership boards when I first qualified. And they don't really function in the way that they did anymore. And they're quite tokenistic. So my question going into this, and I guess it's the question I've been asking myself for my whole career, is why aren't learning disabled adults leading the design of these specialist learning disability services? What's the gold standard advocacy and leadership? And how can we ensure that learning disabled adults are central to the design and production of research? So obviously I'm not going to find the answer to those questions in a research internship, but I wanted to go and have a look at what the gold standard was in research at the moment and what people are doing to ensure that learning disabled adults are leaders and not being consulted or asked to sort of give their opinion but actually not involved. So my supervisor from Manchester was Jan Owens, and she put me in touch with Purple Patch Arts. Fantastic organisation, and there I learnt about their model, which you might not be able to see on the picture here, but they use a kind of birthday cake model of level of power held by learning disabled people. And so at the top there is they're in the lead, below that is collaboration, and then at the bottom is advisory. So we want to be aiming for that top tier. You can find out more about them. And I also joined this group, which was People First Tameside, working with Melissa Kirby, who at the time was working with Jan Owen. She now works at the University of Leeds. And so they produced some research for Salford Royal NHS Foundation Trust. And you can go there and find out their YouTube channel. I also learned about the fantastic work of these guys and their network at PCIE. Got my new job, talked about that. I did a course with King's on qualitative approaches to research, and what I actually learned from that course was, wow, the way qualitative research is done does not include people with an LD in the methodology, actually, and that good quality interviews are considered people who are articulate and can, you know, talk the talk. So, and attended a few conferences, and I think I've thanked and mentioned all of those people. So sorry for rushing at the end. But yeah, that's me. Thank you.